Everybody thinks that the pandemic is over with, but let's hear what the World Health Organization director has to say about that.
As countries lift public health and social measures, they must consider the impact on health workers and health systems. Delta and other highly transmissible variants are driving catastrophic waves of cases, which are translating into high numbers of hospitalizations and deaths. Say today is that we're experiencing a worsening public health emergency that further threatens lives, livelihoods, and a sound global economic recovery. It is definitely worse in places that have very few vaccines, but the pandemic is not over anywhere.
This one is worrisome because the original virus, whatever that infectivity was, the Alpha variant or UK variant was about 50% more infectious. The Delta variant is 50% again more infectious. So we're starting to see, we've had outbreaks in 5 different summer camps for kids as kids are getting back together. And it spreads into the community. We didn't see that with the original virus. So I'm very concerned about school districts that are not going to have masking. I'm very concerned about communities where immunization rates are low.
The World Health Organization is fully aware that the vaccines alone will not get us out of this pandemic.
Vaccines have never been the way out of this crisis on their own, but this current wave is demonstrating again just what a powerful tool they are.
So why is this happening? How come we're having these spikes again? I mean, it sounds like we're going backwards.
Context of a highly susceptible global population because of low vaccination coverage, because of the uneven use of vaccines, the inequitable distribution of vaccines worldwide, and the low levels of seroprevalence based on natural infection around the world, largely in many countries who put in very strong measures to keep their populations protected. We also see this in the context of increased social mixing. What I was referring to was the increased social mixing in the context of the relaxation of public health and social measures. It wasn't necessarily related to the event itself. We know many gatherings can be held very safely.
And what we've seen is vaccines are not perfectly effective at preventing transmission. They're highly effective at preventing hospitalization and death. And it is our view that the two measures together, public health and social measures, individual measures, and vaccination working together can keep this disease at some level of control.
So there you have it. You know what to do. You have the tools to do it. So let's get it done. Let's get through this pandemic. If you like this video, like it, share, and subscribe for more videos like this one. Thanks for listening, and I'll see you in the next one.